Did you know that sleep deprivation can increase your cancer risk? But you can fight cancer much better if you get enough sleep every night. In this video, you're first going to learn about the sleeping process and why we sleep. Then you're going to discover things that happen if you don't get enough sleep. And finally, you're going to find out ways to get to sleep quicker. So let's start. Sleep is an essential physiological process for humans and most animals. The body follows circadian rhythms to regulate your sleep. Your circadian rhythm is a 24-hour internal clock that is running in the background of your brain. This process is also known as your sleep-wake cycle. Circadian rhythms direct a wide variety of functions such as your wakefulness, body temperature, metabolism, and the release of hormones. Circadian rhythms follow the sun. That's why it coincides with the cycle of daytime and nighttime. Your pineal gland controls your circadian rhythm. It's a small pea-shaped gland in the middle of the brain. When it's dark at night, your eyes send a signal to the pineal gland that it's night. Your brain in turn releases melatonin, which makes you tired. Melatonin is a substance found in animals, plants, fungi, and bacteria. In humans and animals, melatonin secretes during darkness. Physiological functions such as sleep and blood pressure regulation depend on it. Your circadian rhythm works best when you sleep at regular times. Jet lag, daytime savings time, or staying up at night can disrupt this natural process. There are two basic types of sleep: rapid eye movement, REM sleep, and non-REM sleep. Each state uses specific brain waves. You cycle through all stages of non-REM and REM sleep several times during a typical night. There are 4 stages of the non-REM sleep. Stage 1 non-REM sleep is the changeover from wakefulness to sleep. During this short period, your heartbeat, breathing, and eye movements slow down. Your muscles relax with occasional twitches. Your brainwave activity begins to drop. Stage 2 non-REM sleep is a period of light sleep before you enter deeper sleep. Your heartbeat and breathing soften, and your muscles relax even more. Your body temperature drops and eye movements stop. The brainwave activity lessens. Stage 3 and 4 non-REM sleep is the beginning of deep sleep. Your heartbeat and breathing reach their lowest levels during sleep. Brainwaves become even slower and produce delta waves. You won't experience any eye movement or muscle activity. At this point, it becomes a little harder to wake up. REM sleep first occurs about 90 minutes after falling asleep. Your eyes move fast from side to side behind closed eyelids. Your breathing becomes faster and irregular. The heart rate and blood pressure increase to near waking levels. Most of your dreaming occurs during REM sleep. Exposure to light can make it difficult to fall asleep or return to sleep when awakened. Night shift workers often have a hard time sleeping. They also have trouble staying awake at work. That is because they disrupt their natural circadian rhythm. The amount of sleep you need depends on how old you are. Newborns need between 14 to 17 hours of sleep, while most adults require 7 to 9 hours of rest. So let's learn what happens when you don't get enough sleep every day. Sleep is crucial for many bodily functions. When we skip sleep, our biological functions don't work as well. We may feel lethargic and sleepy or have reduced concentration and memory. The body needs to rest to recharge and heal itself. If you stay up late, you disrupt the rhythm of the body and make yourself tired. During the night, your liver needs you to sleep to preserve energy for its crucial work. If you don't sleep, then the liver can't receive enough blood to function. That can result in an accumulation of toxins in the liver and bloodstream. The body's acidity rises if toxins accumulate during a long time in the intestinal fluid of the organs. High blood toxicity results in the secretion of stress hormones, which create more diseases. Inadequate sleep is the reason why many lack energy. Poor sleep combined with our bad eating habits drain our energy. We then use coffee, energy drinks, sodas or sweets to conquer this tiredness. But this of course leads to more toxins entering our bodies and causes more problems. Immunity diminishes as fatigue increases and makes your body worse at defending against pathogens. Melatonin relays information about the cycles of light and darkness to all the cells in the body. Light during the night messes with the molecular clocks in the brain. Suppressing your natural cycles makes it hard for your body to fight cancer. Published research has shown that melatonin offers protection against reproductive cancers. Cells throughout the body have melatonin receptors, even cancer cells. So when melatonin triggers during the night, cell division slows down. David Blask has done several experiments on rats. He exposed them to light during the whole night, which suppressed the melatonin. The rats that got exposed to light were more likely to grow cancer than those living in darkness. One study looked at breast cancer rates in night shift workers. They examined 78,562 women in the Nurses' Health Study. Nurses who worked nights had 46% higher rates of breast cancer. Insomnia is common among cancer patients. Pain, surgery, chemotherapy, or radiotherapy can often trigger it, or depression and anxiety. Our stressful thoughts make it harder to fall asleep. Many people don't know how to relax and find a balance in their lives. Instead, they try to distract themselves from their worries. Some people use drugs or alcohol to hide from the pain. Others use entertainment to suppress their feelings. They either watch movies, read books, listen to music, or go out with friends. The only time that we can't divert from our stressful thinking is when we go to bed. That is why so many people have a hard time falling asleep. They then stay up all night until they collapse in bed. If you want to reduce your cancer risk and insomnia, then it's vital that you sleep at regular times. So let's discover how you can get optimal sleep and lessen your cancer risk. As I said earlier, your body follows the rhythm of the sun. You should go to sleep no later than 10 p.m. and wake up at 6 a.m. The sleep between 10 p.m. and midnight is the most important. This is the period when deep sleep, necessary purification and renewal happen. Oxygen consumption is 8% less during that period. This state is 3 times deeper than the sleep you get after midnight. Sleeping 8 hours a day will help the immune system. If you need more than 8 hours of sleep, then go to bed at 9 p.m. Here are some steps you can take to improve your sleep. Make sure that your bedroom is dark at night. Turn off all lights in your room and allow your eyes to adjust for a few minutes. See if you can identify objects and check for light leaks. Fix the light leaks until it's pitch dark. Use drapery or window blinds in your bedroom to block any light from coming in. Or use a sleeping mask. Mentally prepare to go to bed no later than 10 p.m. Brush your teeth or do your other night routines 1 hour before going to bed. Avoid watching YouTube or other entertainments as they can upset your stress levels and ruin your sleep. Try to use a relaxation technique before going to bed. Download this ebook for free to learn 7 different techniques you can use to fall asleep fast. Also discover the steps you need to follow to make the sleeping process much easier. The link to this ebook is in the description below. After using one of the relaxation techniques in this ebook, go to sleep at 10 p.m. and turn off all lights. If you have to go to the toilet or get up, then use a salt lamp that emits red lights. Avoid using any bulb with a blue light or you mess with your melatonin levels. If you feel restless during the night, don't get up. You can still get 90% of the energy even in an awakened state so long as you lie down. Try to avoid using an alarm clock if you can. A sudden alarm sound can create stress and affect your mood. Instead, wake up the natural way. If that is not possible, try to use an alarm clock with sweet bird sounds or relaxing music. Or use a device that gradually increases the light in the room. Sleep between 10 p.m. and 6 a.m. or earlier if you have to get up before that. Continue to sleep at these hours every day. If you fail to follow this schedule, don't be hard on yourself, but instead try the next day. The body follows circadian rhythms to regulate your sleep. The pineal gland is a small pea-shaped gland in the middle of the brain that controls your melatonin levels. Melatonin secretes during darkness and makes you tired. There are two basic types of sleep: rapid eye movement, REM sleep, and non-REM sleep. You can destroy your immune system if you stay up late all the time. Then I told you how to sleep better to prevent cancer. So now you should understand the importance of sleep and how to use it to fight cancer. If you enjoyed this video, then press the like button and subscribe to the channel. Share this video on social media to all your friends and families. Please visit our blog at cancerwisdom.net to learn non-toxic ways to treat cancer. You can also download more free documents in our free resource library and learn other ways to prevent cancer. Thanks for watching, and I'll see you soon.